When I was born, I was immediately placed in the custody of the state of California, quickly enough that they didn't even have time to name me. My original birth certificate had my name as baby boy. I started going to therapy on campus, Emmaus Road Therapy. And I saw a counselor there for probably about 2 years. We began to look at a lot of factors in regards to my childhood and being placed up for adoption. One of my professors, he said, Michael, you will oftentimes run into these places where you're trying to put out fires that don't even exist yet.
In this episode of the Wayfaring Stranger podcast, I talked to my friend who is a psychologist, Dr. Michael Fenske. In this episode, we discussed some formative experiences surrounding his adoption that led to some of the reasons that he became a psychologist in the first place. We also discuss some common triggers of anxiety, how he reconciles his faith with his practice of psychology, as well as some of the misconceptions and/or stereotypes from the church about psychology. This conversation was very informative and educational for myself, and I actually learned a lot about my friend that I did not previously know. I hope you enjoy this episode as well.
Getting into psychology, that's a kind of a life story. So it starts at the very beginning, as all great stories do, wherein I was born in Sylmar over in the San Fernando Valley. And I was actually, I would even say the story about how I got into psychology even predates my birth, wherein my biological mother was at a drug rehab facility. And while she was there, one of the attendants took advantage of her, and 9 months later, that's where I came from. When I was born, I was immediately placed in the custody of the state of California, quickly enough that they didn't even have time to name me. My original birth certificate had my name as baby boy. Soon after, I was placed in a foster home with an older lady who was really unable to hold babies past a certain weight just because she was older, wasn't able to do that. And so this lady, she grew up next to a family wherein the kids in this family would play with her kids and whatnot for years. Well, that family that she was living next to, they grew up, and the kids that were in that home became foster parents. And so she contacted them, hey, do you want to take this foster baby? And they said yes. So 5 weeks later, I went to go live with my second foster family, wherein I lived with them until I was 5 years old and was officially adopted by them. So that was, my parents, Larry and Verlene Fenske. And growing up, I was the youngest of 8. They had 4 biological children, 4 adopted children. So it was 4 boys, 4 girls. The biological children, it was 3 girls, 1 boy. And then for the adopted ones, it was 1 girl, 3 boys. Mm-hmm. So we grew up in a Christian home up in Lancaster. Same home, always kind of grew up in the same house. My parents still live there. And there were just some significant things that happened throughout the years that kind of influenced my mental health, my family. In 1995, my brother, their biological son, was killed in LA County jail. And the whole circumstances around it were very suspicious, even the whole circumstances as to why he was taken to the jail. And we had hired a private investigator, and there was a lot of stuff. The LA County Sheriff's Department was at the time engaging in a lot of really suspicious behavior and was trying to shut down the investigation. My parents, for a time being, had a lawsuit going against the LA County Sheriff's Department, and ultimately they ended up dropping it due to certain intimidation tactics that were taking place. And so that influenced me. That influenced my family. I was little. I still remember the whole situation. And years later, many years later, through different things, different situations, you just kind of grow up in high school, dealing with the high school situations. I went to college. And when I came down to San Dimas, California to college, I was planning on going to school to be a youth pastor. I went to Life Pacific College, now known as Life Pacific University. I started in the spring of 2010, so it was halfway through the academic year. And about a semester or so in, a year or so in, I had a roommate who, him and I were really, really close. And he had a good friend whom he had grown up with in Santa Clarita, and that friend was stationed overseas. I believe he was in Afghanistan. I'd gotten to know the guy a little bit. I wouldn't say that we were like close friends or anything like that, but I'd gotten to know him. And while we were there, during the spring, around the time of spring break 2011, I had gone home to another friend of mine, Tim Kalunga. You might have met him.
Mm-hmm.
I went home to go see my family. My family was out of town that day for the next few days. So I spent a few days at my friend Tim's house. Well, the first night of spring break, I get a phone call from my roommate. His best friend in Afghanistan had been killed in action. So that was kind of like impacting both of us. Significant, impacting him way more significantly than it did me. But that was just kind of like, wow, it really puts life into perspective. Now, from that situation, my spring break kind of went downhill a little bit. My mom had had eye surgery recently. It wasn't healing properly. My sister was having some medical difficulties. I was talking to a girl for about a few weeks, and out of nowhere, she just kind of decided like, oh no, we're done talking. No real explanation. And so I didn't really know how to process that. So once the spring break had ended, I'd gone back to campus, and it was pretty quiet on campus for a minute. And my roommate didn't return right away. So I was in the room by myself, and I always kind of referred to my room at that time as a black hole of depression. And around that time, I had also started a counseling class to kind of just get an idea as to what counseling looked like, what it looked like to do counseling. And I reached out to the actual counseling services because I was like, I need to, kind of figure some stuff out. And so I started going to therapy on campus, Emmaus Road Therapy. And I saw a counselor there for probably about 2 years. And so we ended up processing a lot of different things. A lot of different factors with the immediate depression that was going on. And then we began to look at a lot of factors in regards to my childhood and being placed up for adoption. And it was really integral work. Kind of had me look at concepts like attachment. Attachment is, how young individuals or little children develop connections to their, what we call primary caregivers, usually their parents or grandparents. And how when those initial attachments are impacted when you're young, it impacts you as an adult. And it can impact your relationships and connections with people as adults. So that was something we'd kind of focused on. Well, by doing this work in therapy and taking this class, I was like, man, this seems like a really interesting field. So I'd begun to pray about it and think about it and whatnot. And I remember some time into that semester calling my mom, being like, hey, I think I want to switch directions. I think I want to go into counseling. And I was looking into what to do after school and whatnot, what it would look like to take the next steps. And so I ended up graduating with a bachelor in biblical studies with a minor in counseling and youth ministry. And so from there, I applied to go to graduate school and go straight into a doctoral program, what we call a PsyD, so a doctorate in clinical psychology, at Azusa Pacific University. And so I only applied to one school. I was really kind of taking a risk there. And so applied to APU, ended up getting in and did graduate school and kind of jumped into the field of psychology. A lot of really interesting stuff happened along the way in graduate school and in the journey since graduating, but that's kind of what got me into the field of psychology and counseling and therapy.
So I would say the school I went to, I also went to a Christian school, and I don't know how accepting they would have been, just like the general, like probably the faculty and the students, about going into like traditional psychology or modern psychology. How was the feeling of that at Life Pacific?
So at Life Pacific, we only had one major when I started. You only get a major in biblical studies. By the time I was about halfway through my time at Life Pacific, they had added another one called Transformational Ministries. And my professor, Dr. Gail Samples, taught like 2 or 3 psych related courses. It might have been a little bit more, but there was no formal psych program. And in her classes, she talked about options for grad school. So I felt very supported in that regard. I don't know that I necessarily felt any resistance or anything like that from any of my other professors, my professors of theology or pastoral ministry or anything like that. Although I wouldn't say from many of them I necessarily heard anything specifically heralding the field of psychology. Now, in the years since I've graduated from Life Pacific College, they've added a human development and psychology program, a degree. And so I've actually had the opportunity to teach their abnormal psychology class in that program. So regardless of what the mood was or the approach was back then, which I can't really say, I know that they're supportive of it now. I can say that some of the other students that I graduated with or that had graduated around the same time as me also went into counseling, the counseling field. Several of them became marriage and family therapists. Yeah, and I keep in contact with a lot of them even today.
So was the therapist that helped you out, were they a traditional psychologist or not?
No. So in the field of psychology, there's a lot of different degree and license types that can permit you to conduct counseling or conduct therapy. In psychology, there is like marriage and family therapists, there is masters of social work, there is licensed clinical counselors, and then there's psychologists. And so you can get MSWs, MFTs, those are like the degrees, the master's degrees,
What's MSW?
master's of social work.
Okay.
You can get a master's in clinical counseling, and then you can get a doctorate in clinical psychology or in psychology. So either a PsyD, PSYD, or a PhD. And so a lot of those things, you can get these degrees, and as long as it qualifies for the standards necessary in your state, you can then take licensing exams and be licensed as a counselor or a therapist or psychologist.
And so what was your therapist licensed as?
I know that they are a marriage and family therapist. I think they might have been a trainee at that time.
Okay.
Yeah, I think they might have been a trainee at that time, that they're currently a marriage and family therapist. And what's ironic, and this is pretty rare in the field, is that I actually I still keep in contact with them, especially because we both provide services in the same general region, and we just had a lot of overlapping communities. So I still actually run across them. I mean, they've always been very professional, and I've always been, being a therapist myself, I've always been very professional about my interactions with them. I don't want to put them in a place where they feel, like, oh, I have to abide by these rules. And we've actually maintained I would say a very professional but cordial relationship, even after therapy has concluded several years ago, almost a decade ago.
So what about that experience helped form your idea of how this can be helpful and why you would want to get into it? Just because you saw how it transformed you? Or was there anything specific, like insights that you got from that you thought were really powerful?
So When I had started therapy, that was a huge catalyst. That was a huge catalyst. When I had started therapy, I had actually worked with two therapists. One therapist, I worked with her for I think about 2, 3 months. And then she was also a trainee and she moved on to the next location. And then I worked with the second therapist. And I remember even just in the 2 or 3 months I had started with the first therapist, I remember even asking her questions about the field because I remember growing interested in like, oh, like this is something I could look into. I was really appreciative of the work that was taking place. I felt like there was a lot of significant information that was happening for me, and I wanted to help provide that for others, specifically for university age students, which is actually a huge part of the population I work with now. And so, because of my experience in therapy, it really influenced my desire to go into the field.
Interesting. So, when you started going into psychology yourself, were there any things that you were surprised by that you hadn't encountered personally? Were there any things that, for good or for bad, just any things that you didn't really think about before getting into it?
I think that's a really interesting question just because there was a huge plethora. I mean, I could sit here all day and tell you about all the things I didn't really think about. But I think some of the significant things were both how faith plays a part in psychology and maybe how it doesn't. Different aspects of people's mental health, people's development, how private practice works, what kind of fields are available to people that get involved in the field of psychology or whatnot. What job types can people engage in? What are some of the difficult aspects of it that I had never considered? I mean, a lot of times we take in as therapists a lot of information. We hear a lot of suffering, a lot of suffering, a lot of trauma, a lot of stuff like that can impact you pretty significantly if you're not equipped to know how to deal with it. And so a lot of that stuff was not really on my radar when I was looking into this really cool field where I can just like listen to people, I can just talk with people and hear what they have to say and then give them good advice and then get paid, buco bucks for it. It turned out it's not really what happens,
I actually wanted to ask you about that. How do you deal with I'm assuming sometimes overload of pain, suffering, or whatever? It could just be the overload of people's anxious thoughts and depressive thoughts as you're a person and going through your own stuff as well. How do you deal with that?
It's interesting because therapists make the worst clients. It's a statement I've heard, and everyone thinks that therapists, psychologists, you name it, have their stuff together and figured out, and that couldn't be farther from the truth. I mean, you can just ask my wife. She gets to see a lot of the non-therapist Michael. I'm actually thinking of a conversation I literally had yesterday where I was talking to one of my colleagues in the office, and we were talking about the work that we do to help contain clients that come into the room, and we try to help contain what's going on. So what that just, to kind of give you a visual, it's like an ever expanding blob that you want to put into a box, and the box contains that. And so we'll call the blob anxiety. And so you want to be able to contain the anxiety. And so a lot of times what that involves is compartmentalizing. It involves a lot of self-care.
You're talking about containing your own anxiety or other people's?
Both.
Okay.
Both. And I actually, it's funny because I have a strategy that I actually employ in therapy wherein I will have clients that come in and they will sit down across from me and they'll tell me what's going on. They start to get really loud and really fast. They'll start speaking super quick, super loud, just going on and on and on about all these different things. And so I'll sit there, across from them and I'll feel myself start to get a little anxious. It's this projection that's taking place where I'm kind of picking up on their feelings and emotions. And they're getting really fast and really heated, practically sweating as they're telling me these stories. And I'm sitting there. And when I recognize this, I employ a tactic where I use my obnoxious therapist voice. And what that is I speak obnoxiously slow and I speak a lot quieter, a lot smoother, like a podcaster, if you will. And so what that begins to do is it models kind of calmness in the room. And I'll even talk to the client and I'll be like, hey, this is what I do. I tell them about the therapist voice. I'll tell them, because I don't want this to be any kind of heady, head games. So I'm usually pretty upfront about what process is taking place. And I'll be like, I want you to practice your therapist voice. And so that can be a part of our containment. Other times we'll do mindfulness breathing activities. We're just, doing some breathing. We'll do some progressive muscle relaxation where you're tightening your muscles. So, for a second, just take your fists and clench them as tightly as possible. And then feel the tension in your forearms and then just relax them. And pay attention to the relaxation as you release your fists. And so that's a part of progressive muscle relaxation, and I'll incorporate those techniques in the room to help contain their anxiety. And oftentimes it's really effective. I'll have clients tell me like, wow, I feel a little bit better. Usually I use like a scale of 1 to 10. On a scale of 1 to 10, where's your anxiety at right now? 1 being barely even notice it, 10 being worst anxiety I've ever felt. I always do it before and after an intervention, and usually I'll go down a point or 2. And it's like, okay, well, let's kind of calm down and then we'll talk a little bit about what's going on. So containment can be a big part of it for what's happening in the therapy room. For myself, self-care can be how I manage kind of the experience of what's being told to me. And sometimes clients will tell you about stuff. They'll tell you about trauma or grief that they're going through that just sticks with you. You'll think about it outside of therapy. So that's that can be a big part of the field, is how do you manage that?
How do you deal with anxiety for yourself in the moment? Or would you say like these are two opposite ends of the spectrum, or are they related inversely, like depression and anxiety? Because I think of depression being a little bit more despondent. I think of anxiety being a little bit too worked up. And so with yourself, do you find yourself in your life have leaned towards one or the other?
So I think that's actually a really interesting perspective, and you can almost feel like anxiety, depression are different sides of the same coin. For myself, I've always kind of leaned more towards anxiety. I have had I'd probably say I've had one small bout with depression years and years ago as a teenager. I can't even remember necessarily what's going on, but I had a small bout with it. I might have experienced some anxiety, very shortened, not anxiety, some depression related to certain obligations that was going on in my life or whatnot, maybe a breakup. I didn't handle breakups well. And that was, as I came to find out, a lot to do with that attachment that I was mentioning earlier. But anxiety was a big one for me. And it's interesting because I'll even talk to my mom and she's like, oh, you've always been anxious. And I'm someone, I like to have all my ducks in a row. I like to know that I have financial security. I like to know what the plan is. I don't like to not know what's going on. I've definitely had to become more comfortable with that. Fortunately, Alex has also kind of really helped me with that. She's helped me kind of be a little bit more laissez-faire, kind of go with the flow, or at least I should say trust God. I can't even begin to tell you how many times she encourages me to do that. But I would say recently, within the last about a year and a half ago, I had some significant anxiety, and I was doing licensing for my psychologist license. And that is a really in-depth process. Think like the bar exam for lawyers, but instead this is for psychologists. It's that level of difficult. And it's not uncommon for people that take this psychologist exam. We call it the EPPP, the exam of professional practicing psychology or something like that. It's not uncommon for people to take it multiple times because you just don't pass. In the counseling center I was working at one of the CSUs, the California State University here in Los Angeles, most of the individuals there had taken it more than once. Some had taken it 3 times or more. For me, I had taken it a few times, and each time was just really frustrating, a lot of anxiety. And so leading up to each time I took it, my anxiety would skyrocket. And so the last time that I ended up taking it, unfortunately passing, I had started therapy. I had actually gotten back into therapy. I had also actually started taking anxiety medication. So I was taking a norepinephrine reuptake inhibitor, an SNRI is what it's called. I guess the name of it's like duloxetine or whatnot. So it's an anti-anxiety medication. So I was taking a little dosage of that as prescribed by my psychiatrist.
Did you notice a difference?
I did a little bit at first, but I noticed I wasn't feeling as anxious. And I actually attribute the reason why it was so difficult for me to pass the exams before was not so much because I didn't know the information as much as it was my anxiety was getting in the way. And so that's actually a huge factor in regards to test taking in general, is that anxiety can really impact how you perform.
Yeah,
It's
performance
test
anxiety. Yeah.
So I was doing both of those things. I was taking medication as prescribed by my psychiatrist and whatnot. And I really picked a very interesting time to take this exam because I actually didn't tell, whereas I had always kind of told Alex ahead of time, like, hey, this is when we're going to do it. Like, this is the scheduled date for the exam. I didn't tell her the last time that I wanted to surprise her. And that was still a lot of anxiety kind of hold in. And I mean, fortunately, I passed. So it was a great surprise. But at that same time, a big factor of surprising her was I wanted to do it before our wedding. So we were to get married a few months later. So I ran the LA Marathon right before the exam. It was a few weeks before the exam. And that was actually anxiety evoking because like, okay, am I ready to do this? Have I trained enough to do this? Do I have the right equipment? I don't want to like get out on the street and then pass out or anything.
Oh, marathon.
Yeah, of the marathon. And then I took the exam and that was the same thing. I was studying hours upon hours a day, and she can attest. I was probably studying 3, 4, 5 hours a day just to, get the information and be able to recall it. And then we had wedding planning on top of that. And I feel like there was like 1 or 2 other major obligations that we had going on around the same time. All those things happened a few months after we got married. I actually transitioned jobs. So I went from one California State University to another. I was originally at CSU Dominguez Hills over in Carson, California. So that's kind of like South Los Angeles. And then I had transitioned to Cal Poly Pomona, which is a CSU. And so just transitioning to a different job was pretty stressful in itself. However, it was a nice transition because my commute went from like an hour and a half to like 15 minutes.
Right. Yeah.
So that was a little bit with my experience with anxiety was, I guess, to kind of put basically, I was in therapy and then I was taking medication as prescribed by my psychiatrist.
Do you find any common causes or triggers to people's anxiety nowadays? Actually, just a few episodes ago, this book keeps coming up. Jonathan Haidt wrote a book called Anxious Generation. I'm not sure if you've heard of it.
I've heard of it. I haven't read it, but I've heard of it.
Yeah, I think it just came out this year. He also wrote Coddling of the American Mind, and in that book, are you familiar with that?
No, I'm familiar with the concept. But
Yeah. So the idea is that basically it's more like social psychology, but he's interesting because he's talking about it on a societal level. And the famous anecdote that he brings at the beginning of the book is basically people are treating ideas as dangerous, which causes a higher response to them if they hear something that they don't agree with. So instead of it just being something that they don't agree with, they classify it as dangerous. And the example he brings is peanut allergies have skyrocketed since the late 90s because the thing was like when he had a kid, one of his kids, he went to a parent-teacher meeting and they told him anyone cannot bring peanuts into the school because there was like one kid or something that had a peanut allergy. He's like, all right, well, that's kind of extreme, but I understand, we got to be sensitive to this. But it turns out not being exposed to peanuts actually can develop peanut allergies. So if you're not exposed to them as a child, it actually makes it worse. So I wonder, Are there some common triggers or things that you're encountering as a therapist on campus?
Anxious generation, I feel like is a great, I would say even just great kind of definition for what's happening. That's one of the top issues that we see in psychology. That's actually statistical, that anxiety is one of the top 2 or 3 issues that you're going to see. If I'm correct, I actually believe it's number one. And so one of the big things that comes to mind that's a great reminder was when I was in South Carolina, I had a supervisor, an individual supervisor, which just means that she was supervising me independently, who was a psychologist. And she expressed that a lot of the students experience anxiety because they don't experience a lot of adversity, or they don't know how to experience a lot of adversity. And so she said, you're familiar with the concept of helicopter parents, but these are like bulldozer parents. And so to the degree of people contacting professors, like parents contacting professors when their students don't get good grades, parents who will go and prepare the entire process of college before their kids, telling them where they need to be, what they need to do, all these different things, what you need to study. They will bulldoze any potential or foreseeable forms of adversity to where the student has a clear path in front of them, no real adversity. So when they come to actual adversity, they don't know how to handle it. Their tolerance for it is relatively low. And
Yeah.
so a huge part of anxiety management and treatment for anxiety is controlled exposure, teaching them how to deal with that exposure. On the flip side, I would also say that I've run into and I've interacted with some of the most resilient students. A lot of the students I work with, both at Cal State University Dominguez Hills and Cal Poly Pomona, a lot of those students take care of their families. Like they're helping to pay rent, they're working full-time jobs, they're also full-time students and whatnot. And this can sometimes be different than a lot of the more prestigious universities where there's a little bit of luxury being able to stay on campus all day or whatnot. With CSUs, you're usually getting more the working class. And so their experiences, the adversity that they have faced or continue to face, helps their anxiety a little bit, but anxiety is still a significant thing because no one, or I shouldn't say no one, a lot of individuals aren't really trained or aren't really taught how to deal or experience adversity.
A lot of the anxiety you deal with, is it kind of nameless? They don't know why it's happening? Or do you think there are very clear reasons like what you had where you have kind of a specific performance or event that's happening? Or do you find that students are coming to you not knowing why?
So with anxiety, there can be a lot of different, the etiology or kind of like the where it stems from can have several different factors. And so a lot of different types of therapy, we call them modalities, their role is to conceptualize why a mental health disorder comes about. And so for a lot of people, it can be due to chemical imbalances in the brain when there is too little GABA in the brain. For other situations, it can be due to circumstantial, aspects. It can be even how they train their mind to address anxiety. That can be a factor of cognitive behavioral therapy. With stuff like certain therapies like object relations, it can be, maybe some aspects that occurred when you were a child that can influence how you respond to anxiety as an adult. So there can be different factors. I would say even today, though, we certainly haven't, as a broad society, helped necessarily institute things to better help people address anxiety. I think we have oftentimes we've encouraged situations that would propagate anxiety, such as hearing something that you don't agree with, and that creates anxiety. Whereas oftentimes I may hear a ton of different things that I don't agree with, and I kind of need to just be able to shrug my shoulders, like, okay, we just have differing views. So there's a lot of different factors that can lead to individuals experiencing anxiety.
How do you strike the balance as a therapist between listening and challenging what you're listening to?
I think that's actually a really great question. A big part of therapy is listening. And so that's something that I had to learn both early on in my grad school life and my what I have to constantly remind myself of as I work with clients is, you listen first and then you're going to speak second. Like your emphasis should be on listening to what they have to say. Because a lot of times just listening while they're talking can be very cathartic for them. Now, there are certain circumstances where I will challenge somebody because what they may be saying isn't beneficial for them. I've had individuals that will come into session and they'll say something that's just wholly untrue about their circumstance. And, I might be like, I don't think that's true. And I don't think you think that's true. Or just kind of pointing out when they're lying to themselves, when they're trying to lie to me. I might question them. I might ask, okay, well, if this is true, then what about this? And so I always try to do it. I do challenge my clients, but I always try to do it in a manner that is therapeutic and hopefully not destroying our client-therapist relationship. And I think it's also modeling that, yeah, it's okay to be challenged. It's okay to have someone say, I don't think that's exactly right, and know that you're going to be okay afterwards. It's okay to find out that you're wrong, and you're going to be okay. I will sometimes challenge clients, and I actually think that that's part of the work that can be therapeutic. Sometimes we just don't want to go let them engage in maybe unhelpful thinking patterns or unhelpful perceptions of a situation that may ultimately not be beneficial. Sometimes it's just easier to be like, hey, now if we look at this directly, were they trying to be malicious, when they did this to you? No, probably not. Anyways, so yeah, that's what it might look like.
You'd mentioned earlier that you employ CBT, cognitive behavioral therapy. What is that, and how might that help somebody let's just use anxiety for,
Yeah. So I work with a lot of different modalities. I would say that I am integrative. So just meaning I integrate a lot of different types of therapy, psychodynamic, object relations.
What are those two? I haven't heard those as much.
Psychodynamic is something that stems from Freud. And it kind of looks at a lot of like the unconscious and kind of how we operate. Object relations can look at our relations, our earliest relationships with our primary caregivers. There's others like DBT, dialectical behavioral therapy. That one is usually, I actually enjoy using DBT because it's the most concrete type of therapy you'll ever come across. We're not looking at your background. We're not looking at your family. We're not looking at anything. We're essentially like looking at how do you get through the day? What do you do when you get bad news? Like, how do you handle it? It's a lot of regulation, like emotion regulation stuff, how to regulate your emotions. But I often find when I use a lot of those different types and more that I tend to go to my bread and butter, which is cognitive behavioral therapy or CBT. And so the best way to think about CBT is imagine a triangle. And at each point of the triangle, we call it the cognitive triad or the cognitive triangle. At each point is an aspect. You have your cognitions or your thoughts. That's one point. You have your behaviors or your actions. That's the next point. And then you have your feelings or your emotions. And that's the third point. So on this triangle, imagine that there's an arrow that points both ways, to each section. So they all impact each other. They're all interconnected. And so oftentimes what CBT does is if you're feeling depressed, we are going to try and impact or change how you think about things. So we're going to try and change your cognitive functioning, how you engage with your thoughts. And we're going to try and change your behaviors. And by changing those 2 points of the triangle, we're going to impact that third point, that emotion, that feeling. And so in working with anxiety, we're going to engage in cognitive techniques. So cognitive restructuring is we are changing our thoughts. We are restructuring our cognitions or our thoughts.
How you look at something.
Yes. And so reframing is a more intimate way of doing that. It's the actual act of like, okay, how can I look at this situation differently? Maybe kind of coming up with a new narrative for a situation. An example that I oftentimes use in my anxiety workshop that I do is, imagine you're on campus and you see a friend and you say, hey, Sully, how are you? And Sully keeps walking by. Sully doesn't acknowledge you. You can either think to yourself, man, he must hate me. Like, what's wrong with me? Like, what did I do? Like, how could, what's going on with our friendship? Are we not friends anymore? And you can really go down this cognitive, this spiral. You can start spiraling, or you can look at it as, oh, maybe he didn't hear me. Okay, well, go about your day, whatever that might look like. And so there's different ways you can reframe a situation. Thought records. So that's taking a situation or a thought, looking at the automatic, immediate thought that you had. Oh, Sully must hate me. Kind of looking at, okay, well, what's another way to narrate the situation? You're kind of coming up with something completely different, and then you're comparing the two and like, okay, what's a more helpful way of looking at the situation? Okay, this is how I choose to look at it. How does that change my mood? Okay, this, maybe maybe I'm still feeling some anxiety, but it's lower. And that's a really sloppy way of explaining what a thought record is, but I'll utilize thought records, cognitive restructuring, reframing as parts of that cognitive treatment. The behavioral is what we call behavioral activation. Go clean your room. And go clean your room, because when you clean your room, you're going to complete a project. And there's some validation, there's some kind of feeling of success and pride that comes with completing a project.
Right.
And so that can be something that's stimulating. Go to a coffee shop. Don't sit at home all day, in your pajamas, in your room, in your bed. Get out, try and go outside. Go to a coffee shop. Go for a walk, even if it's 5 minutes. I'll encourage people, like, go stand out in the sun for 5 minutes. Get some vitamin D. Mm-hmm. And a lot of research even kind of shows that just doing something, getting out in the sun, that will have significant impacts on anxiety. CBT is, statistically, it's one of the most effective treatments for anxiety and depression.
Mm-hmm. It's interesting you were talking about the reframing, because there's who's the author who wrote a book on this? Anti-Fragile. Do you know who I'm talking about?
Sounds familiar.
So the idea behind it basically is, we obviously know PTSD, but he's talking about PTSG, post-traumatic growth, right? And I think just anecdotally, you can think about, like, I think about people I know who in life have gone through stuff, right? Do I think that they're weaker because of that, or stronger? Now, obviously, there are things that you go through and they will make you weaker physically. You can get certain sicknesses, right? Yeah. Injuries, stuff like that. So I'm not going to deny that it goes both ways, but I think that's a thing I've heard more so maybe in the last 10 or 15 years. I've heard a little bit more, because there is another side of it, right? And also, two people can go through the exact same thing, even if we're talking about an injury or whatever, and come out completely different, right?
Yeah, it's called multifinality and equifinality.
Right, and obviously, right, there's the old anecdote of the alcoholic father with the two sons, right? And one of them's like, oh, well, I drink because that's what was modeled for me. And the other one's like, well, I'm never going to touch it because I saw what it did to him. And it's just two different ways of engaging the same phenomenon, same family. And we know that happens, right? Yeah. Off topic a little bit, but have you heard of Alan de Botton? He's like kind of like a philosopher, psychologist, but he was talking about, he did like a short thing about marriage and love. He's pretty funny. And he was talking about, you are going to marry the wrong person. And then he talks about how people don't necessarily want to feel love. They want to be hurt in a way that's familiar to them. And, also thinking about that experientially, you're just like, maybe that woman's father abused them. Why would they go after an abusive boyfriend? Or, they dealt with the controlling mother growing up. Why did they go for that controlling wife? Like, what's going on? How do you explain why people seem to go to things that they know aren't right, but they just seem to fall into the same relationship traps or habitual traps?
that's a very deep question, and to answer that in complete totality, I don't know that we'd have enough time over several podcast episodes to answer that. I think there can be a lot of factors, and you talk about strong and weak and physical health and whatnot and how those things can impact them. I tend to look at it not necessarily as strong or weak within, mental health or kind of relationships. I think I tend to look at it more in experiences, kind of like you were saying. And people oftentimes, it's like the old adage, better what is it? The monster than the one that you don't, or something like that.
The devil you know,
Yeah,
rather
the
than
devil
one
you know.
that you
Yeah.
don't. Yeah.
And so I think people are just naturally and even subconsciously drawn to things that are familiar to them.
So like, I know how to handle this, even if it's painful.
Yes, and there's okay. Have you ever had an experience where you were walking along one day and you smell something, and that smell takes you right back to your childhood?
Mm-hmm.
And it's that familiar smell. Well, the sense of smell can be one of the most powerful aspects of memory. And so emotions can kind of do the same thing. There's something that's familiar about it. There's something that can draw us into. I don't think anyone chooses like, yes, I'm going to get into, an unhealthy relationship because that's what I'm used to. I don't think anyone would choose that if they had the option.
Right. This is more the subconscious at work.
Yes. And so there's a lot of different factors that can happen. I mean, sometimes it's just like, wow, like that, what an unfortunate roll of the dice twice, that you've ended up in difficult relationships. Other times it can be factors of maybe you haven't been working on being aware of the red flags. Whereas you had maybe an unhealthy relationship that had red flags in year one, and you didn't incorporate techniques or, certain things to be observant of the red flags or address it when they popped up, or, cut off the relationship when enough red flags happened. You didn't develop the techniques to do that. Relationship ends. You begin to move on. Another relationship comes along, and you still haven't developed the techniques to observe or, give special attention to those same red flags. You find yourself in the same relationship. A lot of times people also get hurt from a hurtful relationship, and they're so bent or so desiring to be loved again, so just kind of have that hurt healed, that they will run headlong into the next relationship.
Sure.
I mean, that's the whole concept of like rebound.
Yeah.
And so that oftentimes when you go into rebounds many times aren't healthy relationships themselves.
Mm-hmm.
So those are just less than a handful of factors that can play into that aspect. But like I said, that would be a huge conversation over several, episodes.
Yeah. Well, it's just interesting to me because it's interesting how small things can reverse big lifelong patterns.
Yeah.
Somebody can hear a speech once, or they can just witness somebody having a better reaction than they would have. And that can reverse the whole way they look at the world, or the whole way they look at anxiety, And one of the ones that I've heard a lot is, because I think one of the big things a lot of us do is fight anxiety, and then it makes it worse. It's like quicksand, as opposed to just like, I'm nervous, or I don't feel great, more like acknowledging that.
Yeah. And that's a really integral thing to say too. When you say that, first thing comes to mind is an experience I had in graduate school where I was really struggling with some stuff regarding my dissertation. And I remember my natural instinct was anytime I experienced some kind of anxiety, I was going to launch into whatever corrective thing needed to happen. I was going to talk to whoever I needed to talk to apologize for, whatever was going on or whatnot. I was going to fix it. It was essentially this fix it mentality, just to alleviate the anxiety.
Yeah.
Problem was, and this is one of my professors, he was actually the director of the PsyD department at Azusa Pacific, mentioned, he said, Michael, you will oftentimes run into these places where you're trying to put out fires that don't even exist yet. You're so bent on trying to correct something or fix something that it may not even be a problem at this time. And so he encouraged me to learn how to sit with your anxiety. And so that was, for me, that was an aha moment. Learning to sit with your anxiety.
What does that mean? What does that look like?
So, and that was a statement that was an aha moment for me that took me several years to really kind of chew on and really kind of think about. And that is, when you're experiencing anxiety over a certain thing, what is it like for you to maybe even literally just sit down and recognize, I'm feeling anxious. And this is why I'm feeling anxious. And I am going to sit here and I'm going to tolerate this anxiety without immediately trying to do whatever I have to make it go away. A big part of anxiety and something that propagates or something that kind of makes anxiety continue on is avoidance. And so we will engage in a lot of different things. My fixing behaviors or my fixing actions was an avoidance technique. I didn't want to experience continued anxiety, so I'm going to engage in what I need to avoid the anxiety. And so in doing that, it actually makes the anxiety worse because next time something comes rolling around, I'm going to engage in that same fix-it behavior. But what happens when I can't fix it? And I'm suddenly, I don't have, these natural calluses towards anxiety, and I'm experiencing anxiety. It's going to feel a lot worse than it would if I just learned to tolerate it, sit with it, and just kind of be aware of it. And that, you could almost say that another word for sitting with your anxiety is learning to tolerate it, learning to just kind of let it be and not try to engage in fix-it stuff. Because ultimately, anxiety is about developing calluses to address it. It's not about making it disappear.
Yeah, that's the interesting thing. I was actually talking to my grandmother about this yesterday because she was talking. My grandfather, he was, a musician, and early in life, he was traveling with my two great uncles. One of them was like the preacher. Like back then, preachers would travel. Now we don't really have that. And then my grandfather and his other brother were like the musical accompaniment and stuff. And so, but she was like, yeah, he was never nervous, never had stage fright. And then later in life, he got invited up on stage. This is way later by like a friend they had who was kind of a well-known musician. And he brought him up just as a guest of honor in front of all these people. And he was like completely fine. Once again, just never nervous. Not boastful, not like overconfident, just didn't have that.
Yeah.
And she's like, he's so exposed to being on stage when he was growing up because of that. He started at like 17 traveling. And so he just got used to it. And I was like, I also heard a story that Steven Spielberg would like throw up before the first day of shooting for almost every movie up until his late 50s when this biography was written about him in the late 90s. And I'm like, and he had been directing movies since he was 12. So I'm like, that doesn't explain it. So some people seem to either never have that struggle, get through the struggle. And then some people like Peter Fonda, also famous actor, in his 70s, still throwing up before his stage plays. So it's interesting because it definitely gets to that point of never got rid of it. But obviously they learned how to cope with it. But they never got rid of it.
Well, and that kind of goes back to what I had mentioned earlier about how there can be biological impacting factors. Something that maybe your family has a history of anxiety. And so it doesn't surprise me when I come in and I have a student sit down and I ask them about, is there any history of mental health illness within your family? Oh, well, my parents, my mom, my dad had anxiety. Okay, well, that can be a factor. And I can't say that I particularly have loved public speaking, but in times of my life, there have been certain times in my life where I've had to do more public speaking and then other, kind of deserts of no public speaking. And when I engage in public speaking, more recently, it's been getting out in front of a class and teaching every week. When I do that regularly, I notice that after, a week or two, I have no anxiety getting in front of the class. other situations where then, I have to get in front of a class or group after I haven't done any public speaking for years or whatnot. And I'm just kind of like, man, I could jump out of my skin right now.
Mm-hmm.
And so it is, an aspect of that controlled exposure. It can also be that biological, physiological aspect that some people just have a natural predisposition to experience anxiety less about certain things.
Sure. Mm-hmm. The sitting with your anxiety thing. So I want to bring it down to something really practical that a ton of people can relate to.
Yeah.
Since you brought up public speaking, I mean, what is that, like the most common fear, I think?
Yeah, that's one of the top ones.
Yeah. So, and some people excel at it are great, but I do think a lot of it has to do with putting in reps and all that kind of stuff.
Yeah.
But sitting with your anxiety when you're literally standing in front of everyone, how does that work? You know what I'm saying?
Yeah, no, and it's funny because I deal with a lot of that with students that'll come in. It's like, I have to do this presentation and whatnot, and I don't, how do I handle that? And so I'll give a few tips. A lot of it is preparation. So I'll tell them, okay, first know what you're going to say. Just some basic speech writing techniques, depending on what kind you use, if you want to write out everything verbatim, word for word, go ahead and do that, and then start slashing things or start, condensing everything down until instead of full paragraphs, you just have a bullet point with one word, and when you get to that word, what you need to talk about. And so when you are intimately aware with the subject matter that you're going to be talking about, the anxiety is pretty low. Now, other things are to practice your speech, practice it out loud, practice it in front of a mirror. So you're seeing your arm movements and facial expressions and whatnot. And oftentimes I'll even encourage this when people have to have hard conversations that they're anticipating, setting boundaries with a loved one. Practice in front of a mirror first. Mm-hmm. Practice this technique. So I have them practice in front of a mirror. If they can, practice their speech in front of a loved one. Maybe a friend or a spouse or, whatnot. So they're getting it in front of somebody.
Do you think there's a different phrase like you would use for that other than sitting? Because I feel like sitting sounds very passive. So for this
sitting with anxiety? Or?
Yes.
I would say, learning to tolerate anxiety.
So it's learning to tolerate. And I think you're right, actually, about like most people who are knowledgeable about something or like, they've done it before, like it will really help you. Like, it's not really just the people. It's the fact that you're in front of them and you need to have some clue of where you're going.
Yeah. And that's, I would say I'd love to do a study on the anxiety behind public speaking, but I would be curious to find out like how intimately or how comfortable do people feel with the subject that they're talking about. If you feel incredibly comfortable with the topic that you're speaking on, you're probably going to have less anxiety. Not to say that you're not going to have any anxiety, but you might feel, okay, like I know what I'm going to say. Because a lot of times that anxiety is, what if I forget what I'm supposed to say?
Sure.
But if you know a subject intimately, not just like academically of like, oh, I know I need to speak on, the Roman Empire and, during this year, but it's more like, oh, I need to tell someone, about where I was born and the town I lived in. Mm-hmm. That subject matter intimately to where you're probably not going to forget what to say.
Right. I want to go into a little bit of the misconceptions about therapy and mental health in the church.
Okay.
So I've actually had a conversation maybe 3 to 4 weeks ago with a friend of my sister's who is going into biblical counseling.
Okay.
And was very like not hot about the types of therapy that you do because it's the view in some circles in the church is that it's been completely polluted, like and overrun by the world. Like even saying Freud would probably trigger a lot of people.
Yeah.
So that kind of stuff. Carl Jung, these guys weren't believers. What do they know? Yeah. So how do you respond? First of all, like, what do you think about that? And then how do you kind of engage or respond to people who have this kind of view?
So there's a lot of conflicting kind of things that'll have happen in therapy in regards to faith or the church, Christianity, whatnot. And I think the first thing is I always feel like I always have to preface this is that a lot of people be like, oh, you're a Christian therapist. Yeah. Like I always kind of, describe like I'm actually a therapist that is a Christian, or I'm a therapist with that, that lives that life. What's really interesting is that not too long ago, I got a phone call from a prospective client that had asked about, they wanted some therapy to kind of work on some trauma and different things like that. And I can't even remember exactly how it had gotten brought up, but they were talking a little bit about their journey in regards to dealing with addiction kind of in the past. And then how the church had been a part of that, a big part of that, and then how their pastor was not super supportive of psychological practices within working with addiction and whatnot. And so they were actually somewhat concerned about connecting with me, a licensed, a California licensed psychologist, and doing therapy, because they were concerned this might be some kind of violation of scripture, that it wasn't something that would be biblically, that it could be sinful or whatnot. And I kind of laughed to myself. And this is where that biblical studies degree, that biblical studies bachelor's degree kind of came in handy. Like, well, scripture doesn't really say, oh, psychology is, of the devil or anything like that. And so I've always encouraged people that I feel like faith and psychology can really go hand in hand, and they can really help complement each other very well. Oftentimes, students because I see university students, oftentimes I'm thrilled to hear when a client is involved in a faith community, because that's an added source of support. It's an added source of community. It's an added source of a lot of different factors that impact their life. And with some of my clients, we don't really touch on topics of faith. I will say with every client I work with, I do in the intake, that's the initial session, the first session, I do ask if they have any religious affiliation, if they're practicing or not. Because you'll hear a lot of clients, especially in Southern California, they'll say that they're either Christian or Catholic, but they're non-practicing. It's something their family did or whatnot. And so we'll talk a little bit about that sometimes maybe not as much. But I've definitely heard some of the pushback in faith and, psychology. I tend to think that people don't push back too hard once they find out what I do, and they find out I was going to school to be a pastor. And it's like, oh, wait, I guess if you were a pastor, because I've technically for a short time, I was actually a children's pastor. If you were a pastor and now you're a psychologist, I guess that means that, it's not completely out there. And that's usually what happens when people interact with me. And I'm usually able to explain it in a manner where it's like, hey, think about it like scriptural or biblical counseling, when you're hearing just practical advice from your pastor. I mean, and I've sat with my pastor, Pastor Bruce, I think one of your first podcast episodes, I've sat with him before, and he's given practical advice that, while he tends to give stuff that's biblically based, he's given practical stuff that wasn't specifically scriptural in regards to when to know, that you need to get a new car, as opposed to keep putting money into your old beat up car. I don't know if scripture says anything particularly about, when one should do that. There are certain dynamics within mental health that I think scripture can really kind of help with. And psychology may be another way we reframe that, or another way that we communicate some of those messages.
Well, I think of it like a nutritionist in the sense that scripture is not necessarily concerned with how to exercise, how to eat apart from not doing it too much, right? So when you get into, like you were talking about GABA, one of the neurotransmitters, right? There's like L-theanine, I take that, right? There's all these other things that you can take. And yeah, I mean, that's kind of like tinkering with the creation that God has made us stewards of. And you can get so specific with it. It's like having a daily schedule. Like I think last week's podcast was about, this guy who's very practically oriented, but also very scripturally based, but just talking about discipline. But then when you get into the nitty gritty of what his discipline looks like, it's like very specific, and I may or may not adopt it, but it's helpful to know.
You mentioned something that I think is actually integral, and maybe it's even kind of what you were hoping to bring up when you first asked the question, is how the church even looks at medication within psychology or psychiatry. And within, I guess, kind of to preface it, within psychology and psychiatry, it's pretty similar. It's kind of close to the same thing. Now, a psychiatrist is a medical doctor. They are a formal medical doctor. They have to do, all the years of schooling that a medical doctor does. They have to do the full-on, I think it's like 3 or 4 years of residency. And a psychiatrist is legally able to prescribe medication.
Right.
Psychologist is more so therapy or testing based. They are going to focus on more behavioral aspects or more emotion related stuff in a practical behavioral kind of experience. And that's even kind of the best way I can put it. Further definition might be a little overly technical even for myself. But within psychology and psychiatry, what we have found is that a lot of people are resistant to medication inside and outside the church, but especially in the church. Like medication it's like taking meth for your anxiety, And so in doing that, I will oftentimes have discussions about the concept of medication and whatnot, and the concept of like vitamins, A lot of people, the way I try to conceptualize it, the way I try to communicate it is, okay, you get sick, you get a cold, right? You decide that you're going to take some cold medicine because that's going to help you feel better. Well, with mental health, kind of a similar principle, right? Especially if it's something that, like you said, it's something neurotransmitter related. Essentially, something physiological is impacting your mood. And so whether it's a cold because you have some kind of virus going on through the body, or you have neurotransmitters that you either have too many or too little of going on through the brain, medications can usually help determine a more healthy amount of neurotransmitters getting where it needs to be. Different aspects of that. And that's an oversimplification of what happens with medication, but that can be a factor. And usually what I will tell clients, individuals, is like, hey, because everyone comes in and everyone expresses an initial, like, I don't know that I want to do medication yet. It's kind of, okay, all right. That's not my first step anyways. Usually that's a little bit down the road. Once we kind of work on some stuff and we feel like, we might need a little extra help, then I might talk to them about, go talk to a psychiatrist. Just schedule a session, schedule a meeting with them, and just hear what they have to say. You don't need to make any decisions, whatnot. Within the church, I'll kind of say something similar. And I haven't gotten a whole lot of backlash. It's also, I would say because of my field and my background, people are probably a little hesitant to argue with someone who has a doctorate in the field of psychology. Whereas if I probably didn't, someone would be like, well, what do you know?
Yeah.
But I tend to be pro-medication when it's relevant. Now, does that mean that certain things are over-medicated? Absolutely. There's a lot of situations where an ADHD can be over-medicated, and we've seen some of the results of that. But I do think that it can be beneficial in many different aspects. Now, the new thing that I have people asking me about is, what do you think about like LSD or psychedelics or, different things like that as medication? And that I usually put my hands up and be like, hey, I don't have research on that. Usually I tend to, encourage people not to do those kinds of things. People will talk about marijuana as almost a medication. So that's a big one. I'll have students that come in, they tell me, oh, I'm using marijuana for my anxiety, and they're self-medicating. And so I usually tell them, okay, well, here's some helpful things to know about that, is that marijuana, while it may in the moment help your anxiety for this half a second, in the long term, research has actually shown that it makes it worse. It can also be contraindicated or unhelpful for things like depression. You wouldn't take a whole bottle of alcohol as a healthy coping mechanism for depression and say that that's medication.
No, but you'd feel better for a little bit.
Yeah, absolutely. Yeah. And people self-medicate with alcohol, but that's also what we call an unhealthy coping mechanism. Same with marijuana use for anxiety. That's maybe not a healthy coping mechanism.
Right.
And so I think it's sometimes, how we look at things, what is the impact of things? Is this something that's, impacting our state of mind? There's a lot of different factors that can go into that.
So what would you say to people who are, like myself and like we have been at church, small group leaders, pastors, people involved in the church? What's helpful for them to know about mental health in the context of trying to serve their community, their brothers and sisters?
Yeah. It's interesting because I think that people in the church, like pastors, small group leaders, they're really the front line. They're really the front line in regards to mental health because they're interacting with people with mental health issues. Pastor Bruce French, asked me a few months ago if I wouldn't mind doing a presentation for some small group leaders in the church to kind of just give them like a basic, crash course in mental health. And so, I talked to him, okay, what kind of mental health stuff do you want me to touch on? Do you want me to touch on the stuff that's more likely to impact our general population? Because that's probably what you're going to be interacting with. And so I created a presentation that, talked about, probably somewhere between maybe about a dozen mental health issues that are the most common experiences in not just the general population, but in the church. And I think having a basic understanding of those things can be really beneficial. Having a basic understanding on what depression looks like, what's not helpful for depression. Oh, just smile. Oh, just feel better. Anxiety. What does anxiety look like? What can be helpful in addressing anxiety? What do personality disorders look like? Personality disorders can have a lot more complex treatment, and sometimes pastors will take it upon themselves to treat, for lack of a better word, personality disorders. And that's something that may require a trained professional that has, an understanding of the disorder first to be able to kind of provide mental health treatment. And so I usually encourage pastors, people within the church, small group leaders, so on and so forth, is just be aware of who your mental health professionals are in the church. Our church at Cornerstone in Glendora has several individuals that are mental health professionals, therapists, and they're connected. Pastor Bruce has several, probably dozen connections to mental health professionals, and he's not shy about referring people to mental health professionals. And I think it's always good just to have a name or a number, or even just what I would encourage people in the church to do is just know how to send someone to psychologytoday.com. Psychologytoday.com is the leading method of helping connect people with therapists using insurance, paying out of pocket, trying to find something affordable or whatnot. It's, the gold standard.
I have a question about that. So if somebody, let's say somebody from church, right, is interested in getting counseling for themselves or somebody else who's going through something, the thing I always struggled with myself is like, how do I know if I'm going to like this therapist? And not like, I don't really care about that. What I care is, how do I know that I'm going to trust them to be effective? Because I feel like even at the intro level, that intern that you had seemed to be pretty thorough and effective in helping you cope with some things. But as with any profession, not all of them are great.
Yeah.
So how do you kind of...
I was going to say, Sully, do you have a friend, I'm doing quotation hands, that needs therapy?
Yes.
The first thing, and I actually tell this, so as I've mentioned, probably a handful, I work, at a university. So I do a lot of different things. I moonlight as a lot of different professions. So recently, full-time, I work as a psychologist at a university, at a California State University. And then I also do private practice. So I'm a private practice psychologist. I see clients on like weekends, on Saturday mornings, and some select weeknights. And then I also teach, or at least I was teaching up until recently. Semester's ended. And so in my private practice, something that I'll often tell clients before we even meet for the first session is, hey, come on in. do a session or two, get a feel for how you like therapy. I always tell people, don't judge therapy on the first session, because that first session is an informational session where your therapist is probably going to be getting background information on you. They just want to know what's going on, what's your family like, what's your job situation like, what's your friendship situation like, so that they have a background to kind of help you know maybe some goals for addressing your concerns. After that, the next 2 or 3 sessions might be a really helpful indicator of what therapy is going to look like. And I always tell my clients, not every therapist is a good fit for every client, and not every client is a good fit for every therapist. That's just the facts. And so I always let them know, if you come in, you do a few sessions, and you don't feel like I'm a good fit for you, that's okay. Let me know, and I will see about connecting you with another therapist. One of the important things I find as a therapist is just being connected to a network of other therapists. And for me, I enjoy giving referrals out to other therapists. It's my way of giving back to my peers and letting them know that, in a way, to these peers, that, hey, I trust you, and I want to send this client to you. And I've done that with several of them, where I've sent referrals to them. So to kind of answer your question, what I would just say is, like, give it a shot. First off, you're going to look, maybe if they have a web page, if they have a Psychology Today page, you're going to look for some things that look like they're buzzwords that are important to you. Maybe if you're looking for a therapist that works with trauma, a therapist that has a background working with veterans, a therapist who maybe does have a similar ethnic background as yourself, a therapist that maybe has a similar faith background as yourself, a therapist that specializes in ADHD. Those are going to be some of the initial things. And then they usually have like an about me section. And this is just across the board, regardless of the website. Usually this is how therapists are going to market themselves.
Right.
You kind of read it, and if it, something kind of like, okay, I'm willing to give this a shot, perfect. Give it a shot, see how you feel. If you don't feel like that's for you, that's okay. I always try to encourage people, don't give up on therapy just because you feel like the therapist you're working with isn't a great fit for you, because likely there's somebody else out there that might be.
Yeah. Well, I definitely gave up because I didn't find someone who was a good fit. But no, do
you need some referrals?
I might, yeah. I think the issue for me was when I did it was during the pandemic, so I just did like BetterHelp because everything was remote anyway. So, and I did a few, and I think I told you about this at some point, but I think my issue with it was, I also have a friend who is very happy with his therapist, and he tells me the types of stuff he gets challenged with. And I was like, mine was not like that. Like, that's what I was looking for. Somebody who can kind of call BS, and, obviously it takes time.
Yeah.
They're like, oh, you need to wait 6 months or something before you can really tell if it's working. I'm like, sheesh. I think that's a bit long for me. But I think, like, early on, my issue was, I knew that. You know what I mean? Like, I know those questions. Like, I can do that myself.
Yeah.
And I think what I look for is a little bit more like, I want you to know things or ask things that I'm not expecting.
Yeah.
And so I want to be a little bit more surprised by this experience. And so that was kind of my issue. But I think also it just came to the point where it's like, that was always the hardest part for me, was getting over that, like, how do I even find someone who's like, I don't know. I got to say it, like, not everyone's insightful. You know what I mean? And not everyone is maybe using their full faculties to really, you know what I mean? I think some of them are doing the listening thing, but not enough of I think I appreciate a little bit more of a challenging thing.
Yeah.
At a certain point.
I would say on the other side of that, I think every therapist out there probably knows another therapist that probably shouldn't be a therapist.
Sure.
And I think if there's a therapist that's like, oh, that's not true, and is listening to this, you're probably lying to yourself. Because I think every therapist knows another therapist that probably shouldn't be out there. There's probably a therapist or two that thinks I shouldn't be a therapist.
Well,
I would like to add, though, I'm sure there's a lot more therapists that are pleased with my work and my qualifications and not. But I think there's a lot of different types of therapists. And what you may be looking for is someone that's a little bit more intellectual as opposed to maybe someone who is a little bit more emotionally focused,
Sure.
or something that's looking more at the emotional aspects. It might be something that is a little bit more grounded in the academic or intellectual aspects of that.
Mm-hmm.
And that can be a part of that search. When you're looking for a therapist, that may be some aspects in the about me to look for. Are they, and almost intellectual or academic in how they communicate what they do and the work that they perform.
Mm-hmm.
For me, I guess the irony is I have a doctorate in clinical psychology, a PsyD, and it took a lot of years to get the degree, but I genuinely hated being a student. Like, I didn't like being a student. I enjoyed the field. I enjoyed the
Mm-hmm.
things that I learned, but I didn't enjoy being a student learning them because I've had difficulty being a student.
Yeah.
I've even been tested and they found like there was some stuff that made being a student difficult. And so for me, I say that because I'm not much of a major academic. I know what I need to know and I know the important things and I know the research, but I'm not a huge academic. I'm more of a blue collar kind of person. At least that's kind of how I like to think of myself. And I think that there are individuals out there seeking therapy that's something that's a draw for them. And for others, that's maybe not their cup of tea. And so everyone's going to have a very particular kind of interest in what type of therapy they do.
Mm-hmm.
I've had four therapists. I've had four therapists that I've met with over the years. I will save the embarrassment of naming all of them, but I've had four therapists for varying amounts of time. One I had for like 2 months, another I had for almost 2 years, another one I had for maybe about a year and a half. And the most recent one I've probably had for over a year. We're getting ready to go on a year and a half, I think.
Mm-hmm.
And they've all had different aspects. I think the only real consistent part about them is that they all actually happen to be female. And they were varying ages where maybe some were like, more so the age of like what I would anticipate my mother being or whatnot.
Mm-hmm.
Some maybe closer in age or whatnot. But there's a lot of different factors that make them different, make them similar. And, some I felt like the work we were doing was a little bit more helpful than others, and that's okay. It doesn't speak to their qualifications or their abilities. It just means that sometimes we're not a great fit. I feel like I'm explaining like a relationship to you, kind of like a breakup. It's not you, it's me.
Well,
We're just not a good fit.
That's how I was thinking about it
Yeah.
because I'm thinking about it like, oh, well, you should give it another try. Don't just go out on one date. You should go out at least 6 months. I'm like, I don't need 6 months to know if I like someone. You know what I mean? Like, but it is a relationship in a
Yeah.
sense, even if
Yeah.
it's a professional one.
Yeah.
But I think the other thing too is therapy always to me had the idea behind it was a little too negative in the sense that it's only dealing with stuff that you're not good at as opposed to trying to get better at stuff that you're okay at. You know what I'm saying? Because once again, going back to a friend of mine, the person he had, I felt like this guy also had experience in business and other stuff like that. And my friend's interested in that. So it was kind of cool to have somebody who had more of a full spectrum of experience that he could relate to. And also see how like his business ambitions or, career-wise stuff related to his emotional state. And that's kind of cool, right?
Yeah.
Whereas somebody who doesn't have any experience with that wouldn't be able to kind of see through what you're saying career-wise.
Yeah.
And so I think for me also just being somebody who likes to create and stuff like that, it'd be hard to be with somebody who has no understanding of that because you're just like, it's a different mindset. Some people are very content not like creating, not putting stuff out in the world. Some people like can't not do that.
Yes.
Yeah.
Yeah.
I'm very restless when it comes to that. I always have to be doing something. And so I think that's just kind of where I was coming at it from as like, also I compare it to like physical therapy. Eventually you would think you don't need it anymore, right? Now, if it goes beyond you just needing it to recover, then it becomes coaching or then it becomes training.
Yeah.
And that's a little different, right? You would say?
So when I actually advertise my services in psychology today, one of the words I use is coaching. I like the word just because I like sports, and our mutual friend Kyle Kampor,
Yes.
is the coach, and so You go to a doctor because something's wrong. Usually, you go to a doctor because you have a boo-boo or you're sick or something like that. Now, with psychology, a lot of times people start off going to a therapist, whatnot, because something's wrong. I'm experiencing depression. I'm experiencing anxiety. And usually it's gotten to a place where the incentive to address it now outweighs the incentive or kind of the laissez-faire attitude of just kind of letting it be. And so this new incentive of, okay, the pressure to actually deal with this is now greater than the pressure to not deal with it. Now I'm going to go and address this. Now, a lot of times people will start therapy and they'll work on depression. And yeah, they might be able to wrap up kind of the depression in, a few months. And it's like, okay, well, what's the purpose in still being there? Sometimes people decide, well, since I'm here, I'd like to focus on some other stuff. There's some other goals I would like to set. There's some other things that I'd like to set. In the American Psychological Association, like the code of, like our ethics code, there's stuff that talks about not continuing to see clients past what's like psychologically valuable, like valid. You're essentially saying like, you can't just see people because you want their money. That's when it becomes unethical to continue seeing someone just because you want them to keep on paying for services.
Mm-hmm.
Now, a lot of times what happens is people will decide after working with depression and feeling like they've had a really good connection with their therapist, they'll decide, there's some other things I'd like to work on. There's some coaching things I'd like to work on, some social relationship stuff that I like to work on. And so that's kind of where I set that aspect up when I talk about, coaching being part of my therapy, because ultimately it's therapy. I am providing psychotherapy. Now, under that, it might have some elements of what does therapy look like. It might have some elements of coaching of like, okay, well, let's talk about setting some goals for life. What are some goals? You want a new job? You want to be able to have these goals in life. Okay, what does it look like for us to learn how to set goals and walk them out? What does it look like for us to set small chunks? We call it chunking, to be able to make these things doable. And so that can be the element that has some therapists continually seeing clients, as opposed to it being okay, we did the anxiety and depression, we're done. At the university, at the current university I work at, Cal Poly, we institute a session limit. And a lot of universities do this to where it's, it can vary anywhere from like 6 sessions. Other universities will do 8, 9, 10, 12 sessions. And then, they'll either, send you off or they'll refer you to a therapist in the community if it's something that requires longer term services. And so in those settings, it is very intentional that we are only going to be working on whatever we can fit in this, 6 to 12 week kind of schedule.
Mm-hmm. Another thing I wanted to hit on, how do you discern between something like spiritual warfare and mental issues?
That's a good question. And
obviously I'm using Christian terminology. This isn't psycho terminology or whatever the right term for that is.
Yeah, it's not quite psychology related terminology.
But more, you don't even have to think of it in terms of your practice, but just in terms of your faith.
So this kind of goes back to a little bit what we were talking about earlier, kind of the hand-in-hand thing. And so I kind of look at it as maybe one helps to explain the other, or one helps put an additional kind of lens on the other. And so, in regards to my own personal beliefs, I believe in the spiritual. I believe in how that can impact people's lives. On a therapeutic basis, on a psychology basis, I also believe in the spiritual in the sense that I think that that's something that can be really beneficial for people to incorporate in their life. Now, in my psychology and Christian worldview, there are aspects where I do believe that it is very interconnected. And there's some aspects where sometimes it's a little bit of compartmentalizing, where I have to kind of look at them a little bit separately. So it's not like I'm going to be talking in my therapy room about demon possession, like, someone here is possessed by a demon, anything like that. I think a lot of that, what I have recommended in regards to certain aspects of spirituality, is even encouraging people to engage in their spiritual community to get further answers. How I conceptualize it in my own life is, like I said, I think it's some things to kind of help me understand putting labels on different things. My faith for me personally comes first. My faith is a huge reason that I'm in the field of psychology and that I am a psychologist. It is the part of me that, really pushes me to want to help people, to want to, encourage people. And I mean, more often than not, when I'm sitting with clients, doesn't matter whether they have a spiritual background or not, I may be praying, for them later on. I may be even in the moment, I might be praying for them silently, whatnot, just kind of, that they may be blessed, that, there would be healing, whatever's going on in that situation. Most people, even in a secular perspective or a secular kind of worldview, if someone offers to go and pray for them, they're usually not going to decline. Some people do, and that's, that's their decision, and that's totally fine. I'm never going to force anything on them. And in a public setting, kind of going out there, I'm not obviously going to offer to pray for each and every one of my clients right there and then in the room with them out loud. Usually what can happen is I have a lot of clients that come in that have a spiritual background, faith background, even at the university. And they'll ask for elements of, hey, can you involve or include elements of faith in therapy? Because we've maybe had a discussion of, understanding some similarities or realizing that we have something in common. Yeah, we can kind of talk about that. I'll talk about, scriptural kind of things to help address their anxiety or whatnot. And that will many times help kind of that process of psychology further along. That'll help bring, for lack of a better term, healing. That'll kind of help that healing process. I'm not going to do something that's contraindicated. If someone's coming in and they have no interest in faith, I'm not going to sit there and be like, well, let me tell you what, the Bible says, or let me tell you what the Quran says, or let me tell you what, what any of these, kind of things say, because that's not for them. That's not going to be something that they particularly find helpful. And that might be something that damages our relationship.
Sure.
I said a lot there, and I'm kind of wondering if that kind of answered the question, or...
I think to a degree, yeah.
It's a very, and that's, I mean, I would say that the question itself is a very complex question, and not in the sense of it's, complex to word it, but it has a lot of depth to it that is sometimes stuff I still kind of work through. And
Sure.
I still kind of work it out and kind of how I understand it and process it.
And it's not always a yes and no, but like you said, it's probably,
yeah.
especially coming from our faith, it's completely interconnected because we believe that sin affects, somebody's disposition. We do believe that there are spirits, we do believe that there's all these other things. So you can't really isolate, like, even as a believer, like, theologically, is this my flesh? Is this a demon? Is this the world's mindset? Like, they're normally connected in some way, so.
And what I would say, I think on even just kind of a general thing, is every therapist out there has their own people. Therapists, psychologists, therapists, counselors, they're people too. And so they have their own their own worldviews, their own faiths, their own backgrounds, which is how they conceptualize what they do and what they study and how they engage with psychology. Everyone has their own way of looking at it. Now, they may not always incorporate that into the therapy room in a very, what's the word I'm looking
for?
Overt, thank you. Overt way. But it is something that's going to impact their worldview, how they operate, what they do outside of the therapy room.
Sure. And I mean, just because you're not religious, you're not neutral per se. You're not a clean slate.
Absolutely. And I would, that's kind of one of those things I would include in that. Yeah, there's a lot of people that maybe because they're not spiritual or religious, they still have their own worldview, perception, and way in which they conceptualize the world.
Well, Dr. Fenske, thank you for doing this podcast. Did you have anything you wanted to end on or just tell people about?
I think just to reemphasize a point I'd made earlier for mental health, methods, some of the best methods to find a good therapist include going on psychologytoday.com pretty straightforward. You just enter in your city or your zip code or whatnot, and then you can, through a filter, you can determine, finding a therapist that takes your insurance or what their out-of-pocket fees are. That's a fantastic way of finding a therapist. And there's, if you don't feel like you're finding a therapist that's affordable, because that can sometimes be a situation, talk to some of the therapists that you come across and ask them if they have connections to people that are affordable. I've talked to several potential clients that ultimately I didn't take on because they couldn't pay for services, but I was able to refer them to services that would be affordable to them. So that's my little shameless plug on getting people connected to mental health services. And yeah,
Awesome.
it's been
man.
a pleasure.
Thank you.
And then the exit music.
Yeah.